Good morning, everyone.
Good morning, everyone.
Morning.
Good morning.
Tammy, you look like you're feeling better. I like your
I'm
smile.
getting there. I
Good.
can't wait to get past this. It's been an ordeal, let me tell you.
Wow. Wow. Glad
But
you're doing
thank
better.
you. Thank you. Being able to breathe is no small thing.
We take it for granted until we're awakened.
So true, Anthony.
Good morning.
Morning, Sharita.
Are we at quorum?
Give me a second. Melissa's our guru on that. And I know that Ebony is going to join us. She'll be a little bit late. She had a mandatory meeting at 10 this morning. She wasn't sure that it would be done on time. I apologize for not getting an agenda out ahead of time, but I'll drop it in the chat for you. I think you can go ahead and call the meeting to order, Sharita. We don't have anything that needs to be voted on right now. The quorum only applies if we're voting.
Okay, guys, good morning. We're officially calling our meeting to order at 10:33 a.m. I do apologize for not having my camera on. I know that's Zoom etiquette, but I am still very much in the hospital with my daughter. And I'm not looking my best self right now. So I'm gonna save you guys the horror, and I'm gonna keep my camera on. Do we have minutes?
I know Anthony has joined us and has started to work on those, so we may want to send those out and vote on them next month.
They
Are we
have been
behind?
sent
Wait.
out to everyone.
Yeah, I think Melissa, go ahead. We finished them, right?
So everyone should have the minutes that are outstanding.
Do it. Cool.
There's
I know
quite a
that
few
there
of
were.
them.
I wasn't in the last meeting, but the meeting before that, I think we didn't have minutes, and so we were kind of behind on the minutes. Is that correct, Colin?
We were behind. Anthony has been diligently going through all the videos and typing up minutes. I didn't realize that they had gotten sent out, so thank you. And they may have gone to your Duke email, Sharita. I don't, Melissa, do you know when they got sent out?
They got sent out over the weekend. I did like the delayed delivery, so no one was getting it late on a Friday.
Got it.
I don't see them. I don't see them yet. So, and we don't have quorum to vote on them anyway. So I guess we can go ahead and skip over that.
We do have quorum now, for the meeting, if there are other items to discuss.
Is everybody okay if we delay our approval of minutes to our next meeting, but everybody also agree to kind of read through all of them and be caught up and prepared to vote?
I don't mind delaying. I do see that I have the minutes, Melissa, so thank you for those. I just haven't read them yet. Sorry.
We can delay till next month. That's fine.
Okay. Let's delay them, guys, because in all honesty, I probably don't even remember
Yeah.
anything. The baby stuff takes forefront and everything else gets pushed to the back of my brain. So we will defer our review of our minutes to our next meeting. The next item on our agenda is our unsheltered numbers by Colin.
Mhm. Our numbers are creeping up again. It is that time of the year when school starts. 56 families are reporting being unsheltered right now. 66 singles are reporting being unsheltered. We have 40 families reporting their risk of homelessness in the next 2 weeks, and 48 singles reporting they're at risk of homelessness in the next 2 weeks. So I just dropped that in the chat for you as well. So those 56 families is the highest number of families I recall off the top of my head.
That's the highest number I've ever recalled as well. And then you said 40 at risk.
40 families at risk are reporting at risk of homelessness. And a caveat with the at risk of homelessness is some of those reporting at risk, when they call coordinated entry, they'll say it's a 2 weeks because they've got a court date for eviction within 2 weeks. So it's not necessarily, not all 40 of those families necessarily have the sheriff coming in 2 weeks.
And somebody from coordinated entry does follow up with those families that are at risk if they have
Yes.
court dates.
Yep, this is Nicole Lamb, the program director of Coordinate Entry. We do. We follow up each week with the clients, and we also let them know that if anything changes, they can definitely give us a call. You know, and we answer till 8 o'clock at night, so they can call us anytime to give us that status of if they're going to be homeless. Some do leave. Sometimes they don't wait for the court date, and some of them just leave the place. So they do become unsheltered. And when they are unsheltered, we get assessment, and then we send it to street outreach team with Housing for New Hope to assess them.
Just curious, do we know how successful street outreach is with connecting with the families?
Yeah, so when we send the referral, Rebecca, the program manager over there at Housing for New Hope, she puts notes in HMIS to say when they've been assigned to a case manager or an engaging specialist. And then we get the notes seeing when they go out to meet them. It's usually within 7 days that they do reach out to the families and assess them. And then here's the thing is that they do put them on the wait list for case management because they are short staffed. They only have 3 case managers, and they definitely have seen the fluctuation of unsheltered families. And we did have 61 unsheltered families last week, but we diverted 5 families to family support outside of North Carolina. So we provided transportation to get them there, so they're safe and not unsheltered.
Okay, thank you so much for that information.
You're welcome.
Well, guys, you see our numbers are growing and we haven't even hit winter yet.
No, and it's very discerning. You know, and I've definitely been talking to family moving forward and, you know, UMD, and we're just, you know, everyone's trying to, you know, get families housed. So then there is more space at the shelter. It's just, there's a lot of barriers.
Right. I know that UMD space is switched to a 30-day shelter. Does that 30-day sheltering caveat also apply to the families, or they get more time?
We try to have the families out within 30 days, Sharita, but it really depends on a lot of circumstances. So what we're seeing, we had a period of time where we were able to get them out a little bit quicker, but we're seeing some chronic homeless families that are taking a little bit longer. And so we're doing what we can, but it's really hard to find placement for them.
Oh, I understand. It's probably only going to get worse before it gets better. And I just don't know when what year better is going to come.
Yeah, we've been watching these numbers with Nicole. It's so concerning. And I will tell you that the board is getting ready to vote on our new strategic plan. If not at this Thursday board meeting, the next month. And the children that are unsheltered, even on the street, we're going to be much more proactive in getting out to those children. Typically, we've opened up just programs that for kids that are in the shelter, but we need to make sure that we're getting all of those kids that are unsheltered on the street as well. So we're looking at some other opportunities to try to be able to do that.
Curious, are we engaging Durham Parks and Rec in those discussions? I know they have after school programs and things like that. Are we engaging our community family
Yes.
resources or the Boys and Girls Club, or they're still in operation? I'm not clear on that.
I don't
But
think
any
that
of those networks, are we
I don't think we
engaging?
have the Boys and Girls Club, but we are definitely partnering with Parks and Rec and some of the others, Partnership for Children, the schools, all of the McKinney-Vento, social workers. We are, if you think of anybody else, please send them our way. We will be happy to reach out to them.
And Miss Sharita, we also, when they call in, we send a McKinney-Vento referral if this kids are in the Durham County Public Schools. Mhm.
Has Ebony been able to help any of those families with even temporary stays or anything like
Yes,
that?
she has when she
Yeah.
has the funding.
Do we have any idea how taxed she is right now?
I was just in
With
another meeting with her and Deja. So after this meeting, I can definitely check with her. I know
She
we
should be
sent-
joining.
Yeah,
in a
she's
little
in
bit.
that child development task force meeting that all the COC providers were in. Me and Tammy were in it too. But that's from 10 to 11:30, and that's where Ebony and Deja are right now.
Okay. All right. Okay, I'm gonna move us because we do have a slot to have some discussions around families later on in the agenda. It's just fresh in my brain because of some conversations I'm having with some other organizations offline, because I still work and encounter folks who know what I do, even while I'm at the hospital. So I just try to keep that stuff in mind, which is probably why some of these conversations are on our agenda for today anyway. Just from some conversations I've had and some things I've seen. So the next item we have on our agenda is our white flag planning. And we need to discuss and determine like the breakout for how many slots will be available for families and singles in the upcoming white flag planning. Colin, did you have anything specific you wanted to add to this conversation before we go into discussion?
Yeah, I remember the last time we spoke about this, Drew Wotton from Open Table Ministries explained that I want to say it's 10 rooms to get started for the beginning of the cold weather season, and it might go up a little bit in January, but at least to get us started. And the question that was posed to the group was, how do we want to allocate those rooms, knowing that singles could get doubled up in a room, and families, obviously, you're not going to be able to double families up for the most part in a motel room. And the group, if I recall correctly, had asked me to do a little bit of a data dig and find out kind of how things broke out over the last couple of years. So I ran a report, and from October 1 of 2021 through September of 2023. So it would essentially cover 2 cold weather seasons, the 21 to 22 and the 22 to 23 cold weather season. During those 2 cold weather seasons, there were 145 households that were served, and that broke out to 77 adults and 68 children. If you remember, families were prioritized for if they had children under the age of 5. So you're not going to be surprised. 33 of the children were under the age of 5. 26 children were between 5 and 12, and 9 children were between 13 and 17. So that's kind of how our data's broken out. So it's just a question of what percentage of rooms do we want to allocate to families? Keep in mind that while we're seeing our family numbers increase, we do have good news that we have prioritized those state ESG funds for street outreach to homeless families and rapid rehousing to homeless families. And those contracts with the state will begin in January of 2024. So there's some possibility that we could look at how do we as a system use those rapid rehousing dollars to help, maybe equitably move people from white flag motels to permanent housing and move people from family shelter rooms to through rapid rehousing to permanent housing as well during that cold weather season, so we can try and minimize length of time in shelter and length of time in motels and try and turn those units over a little bit quicker during the cold weather months, assuming we can find affordable rental units.
Is somebody specifically working on increasing affordable rental units? Especially because we see our numbers increase in the wintertime. Is there any targeted efforts around that right now that you're aware of?
Well, we've got the landlord engagement contract with Housing for New Hope that's going out and building relationships with folks and trying to help bring on new landlords. A mixed blessing that we have. HUD did just recently publish the new fair market rents that will go into effect October 1st. And this is the largest percentage increase I've seen in a fair market rent in my career. The fair market rent is going from $1,315 for a 2-bedroom to just over $1,600 a month for a 2-bedroom on the fair market rent. So while that's good for rapid rehousing, because now we have more rental units that fall in a higher price range, it doesn't help our folks experiencing homelessness in the very low income brackets, that when that rapid rehousing assistance ends, they'll be able to afford to remain in that unit. So it's that mixed blessing of we'll be able to use our money more, but we're going to have to get really, really creative in helping our households experiencing homelessness increase income to support that higher rent burden that's coming in.
Question around it. Are we looking at the Durham Tech's BioWorks program as a potential way for folks to get marketable skills quickly? I think those programs are only like 6 months, and I think there's some grants they help pay for it. So I just recently been looking into this, and actually I'm in a Black parents group on Facebook, and you would be amazed how many conversations I end up engaging in on parents who are working 3 and 4 jobs and trying to figure out how they divide their time between their children and their, the financial responsibilities of taking care of them, and, feeling that pinch of not being able to parent because they're having to work to pay things. And I started looking into that BioWorks program specifically for that, because I'm talking to a couple of mothers and trying to encourage them to kind of go in and do that, as opposed to being stuck working 3 and 4 jobs. So how do we look into our resources at Durham Tech? Not necessarily a CNA MA program, but beyond that, because that BioWorks program also has job placement assistance. And so some people are actually getting matched with jobs that start them at $60,000 a year before they finish the program. So, being able to have those conversations with parents and being able to support them while they maybe go into a program like that, where we definitely know when they come out on the other side, there's a greater likelihood of jobs, especially in that RTP area, because that's the workforce that's specifically being targeted right now, and getting them to a place of self-sufficiency that is meaningful and helpful and not a temporary fix. So I would encourage us to be looking into things like that. How do we get folks connected to those things?
Can I ask a question? It's more just to help my understanding as we think about this from the lead agency space, but are we as a continuum more passive about increasing employment income maybe than we should be. And what I mean by that is, for example, we visited an agency, I can't remember which one, but because it's a short-term agency, referrals maybe are provided to step up, let's say. And then it depends on the client, you know, driving sort of that. So I'm wondering if there's, you know, if other organizations here have something that would be like more active. Obviously, the question about increasing income has to be driven by the households being served, right? But how we talk about it, how we think about it, how we encourage them, and all of that. I'm just wondering if we consider ourselves more passive versus more proactive about it.
Can you kind of expound on that question? Because I'm trying to make sure I understand what you're asking.
Yeah, and forgive me if I'm not really being clear. So I come from the Miami Continuum, as you all know, and so in my shelter, Sharita, we did a lot of the things that you just talked about, right? We had a whole team of people that were like 6 or 7 people who we provided educational programs on site. We brought in certification programs on site. We tried to tailor it so that it was within a person's length of stay, meaning that if we were a 60 or 90-day shelter, that we would try to attract programs that could be completed within that 60 to 90 days so that clients could fulfill the requirements of the program while they were in shelter and leave shelter with some type of certification, some type of job lead, you understand what I mean? So I'm just wondering if we're doing stuff like that here in this continuum.
So I think that's a good question. I think historically, like I know, especially with our families and permanent, our not necessarily families, our folks that we're serving who are homeless in our continuum. I think every year, if I'm not mistaken, is lowered on. We've always got dinged on that increase in income. So I think as a continuum, I don't think that we have done enough on that side. I mean, I think it's like it takes a lot just to get the person to a point of even getting disability income. We don't even have adequate SOAR workers in Durham County. I'm the only one right now that I know of that's doing SOAR in Durham County, and I'm not a full-time SOAR worker in my organization. And Housing for New Hope can't keep anybody, and defunded theirs. I'm hearing murmurings that they're gonna bring it back, but I haven't gotten a direct contact to tell me, hey, Sharita, we got people online, because I'm the person that do consults when they have somebody and they have disability questions.
I do think Sharita, I do think Duke, Sally, you can fix this, but didn't you say the other day that Duke had a new SOAR person?
I was told that. Let me follow up and see if I can get a name.
I was told the same thing, but I still, I haven't, nobody has said, Sharita, this person is doing SOAR at Duke. If you guys have people who need assistance, you know, this person is available to do it. I haven't gotten that communication. Most of the time I get calls inquiring about, can I take a case, or questions they have about the disability process are coming directly to me from case managers within the Duke Health system. So that's what I know. I know that UMD, the second part of my answer to your question is, I know UMD has a workforce development program. I know that they do use Step Up as one of their referral sources, but I think they also have helped people get placed in jobs. The question is the jobs they're getting placed in livable? If they're livable, a lot of them were going to the ballpark, and that was during ballpark season. Right. You know, when ballpark season is over, I don't know if they go somewhere else or somebody helps them find something else. Those are like details that I don't have the answer to. But our biggest challenge that we saw in the last group of rapid rehousing candidates is that over the pandemic, we housed a lot of people, and when the funding was drying up, we didn't have, they didn't have the financial resources to pick up and continue to pay. And so we had a lot of people coming back to the system because they couldn't afford it. I mean, without the rapid rehousing dollars, they couldn't do it. And so we have to figure out how, as a continuum as a whole, to work smarter and not harder, and make those impacts, make the, you know, the things that we're doing and what we're working on with the clients, like, stick in a more permanent way so they can sustain after, you know, any kind of assistance dollars dry up.
Mhm.
Speaking from me as the social worker in the healthcare for the homeless clinic, and I do a plethora of stuff with my clients, even to the employment, the things like the BioWorks program, those are things that I share with the people that I interact with on a daily
Mhm.
basis. If they're looking for work and they're talking about, you know, what some of them have jobs, but they're underemployed, it's not enough money for them to be housed. Those are
Mhm.
the things that I'm pushing to them as options, because I know that going and getting a certification that can give you, you know, a job that makes well over what Durham has considered livable wage, which is not, um, you know, it's more impactful and will help them in the long run, will help us in the long run, because that means that's a person or a family that we're connecting to, you know, a needed resource. We're getting them connected to housing, and if they can maintain their employment, they'll be successful. They'll be able to afford something in Durham County, hopefully, if it doesn't get too much bigger than what it is already, now. So I just think that so you say passive, I'll say, I guess we have been passive, because I don't think people are getting the income that they need to survive without assistance.
Thank you. I apologize. I did not mean to throw us off. These are
No, you
certainly
didn't throw us
conversations.
off.
Okay.
It's a conversation that needs to be had, and you're
Okay.
new to the community, so the only way you get the answers is to ask the question. So
Thank you. Thank you. Thank you. I have some ideas, Sharita, so I may reach out to you when you have some time and just, see if we can kick back and forth on some ideas that we'll come back to the committee with and see if it
and I
works.
don't mean to bombard that
No.
conversation. I think Colleen, are you on the call? So she is our liaison with North Carolina Central. I know early in my career, I had some very young people I was working with that I was trying to get in school. I got one young man into St. Aug in Raleigh. That hasn't always been the most successful, but I mean, I think there's also space for us to talk about those things as well, as how do we tap into that for our singles who don't have children or other obligations that could get them back on track. If they wanted to ever pursue a degree, they can pursue a degree. What we know is that they'll hopefully be on campus for the time when school is in. They don't have, trying to figure out how we intentionally help redirect folks who feel like they don't have, like they feel like their opportunity was missed. So,
Mm-hmm.
I think there's a lot of work we can do around those things.
Thank you.
Good morning, everyone. Lloyd here at the office. I'll chime in. One of the things I've been doing for many years is forwarding information to the homeless housing providers about job fairs to NC Works. I've heard over the years that some organizations apparently do appreciate getting those referrals. It really depends how quickly they come. Sometimes the job fairs are announced within 2 or 3 days before the event. Other times it's a week or earlier. So I think NC Works on South Big Street has resources to assist people who are looking for work. I've also had a good relationship over the years with some of the staff at Durham Tech. I know Durham Tech has a lot of no cost and low cost resources for people that want to get certified in different employment careers, certification programs. So a lot of resources there as well. Back in about 2016, 2017, I think the former HSAC representative from Duke, Mamie Webb-Bledsoe, and I worked with the Workforce Development Board and developed a memorandum of agreement, I believe it was, that the Workforce Innovations and Investment Act resources in Durham would be made available to people experiencing homelessness. That WIAO program is, according to the federal legislation, is to have people experiencing homelessness as a priority population for their services. So I think the ongoing challenge is to make the connections between our programs for people experiencing homelessness and those workforce innovations and Opportunities Act programs in Durham that are managed primarily through the City of Durham's Neighborhood Improvement Services Department. So there's opportunities there. And I do think, Sharita, you mentioned returns to homelessness. We reviewed the numbers from our latest system performance measure report from the federal year that ended September 30th of 2022. And at least in that period, less than 10% of the people or the households had returned to homelessness in the 2 years after they left a COC funded project, well, more generally a HMIS participating project in the COC. So I think most people have brief and limited episodes of homelessness, and then they don't return to the Durham system for a significant length of time. So I think you can feel good about that. Obviously, there's still a lot of people that need assistance.
All right. Sharita?
I'm sorry, I think I heard you say my name. What did you
Yeah.
say, Colin?
Yeah,
No,
you were
just-
muted there for a moment.
Yeah, I just wanted to check, see if there were other discussions or if you wanted to move on and try and figure out if we want to how to allocate percentage of rooms, singles, families.
Oh yeah. So yeah, this is an item we need to make a decision on. Anybody have any thoughts about how we should do it? In my mind, I was thinking 6 and 4, six for singles and 4 for families. If we're gonna have planning to have some intensive efforts to be able to turn those rooms over. And then if we don't need them, they can go to singles.
Sarita, I know I'm late. Hello, everyone. Can you tell me what the question, what's the question on the table? I'm sorry.
We're looking at the question on the table is how to allocate the white flag non-congregate motel rooms over the winter. And we're probably starting with about 10 rooms and hopefully be able to go up from that. And what percentage of those rooms should be prioritized for families and what percentage should be for singles, knowing that singles, we can double up. We can put 2 singles in a room, and families obviously going to be 1 family per room. And whether or not we want to do a set aside and sort of give some guidance to Open Table so that they can, and to Nicole and her team over at a coordinated entry to help prioritize folks.
Will it be the same hotel as past?
No, they're moving over to
Ivy Boulevard.
Ivy
over
Creek,
to-
over on Ivy Boulevard, the extended stay over there.
Extended stay.
Mhm. And the thing is, the hotel, what Drew said last time was the hotel is blocking 10 and they have to have staff there 24/7. They need extensive case management. The hotel is having a lot of problems with blocking rooms for our clients, just because of the history So that's what Drew and I know Open Table Ministries was working on, trying to get more rooms, but right now they only allocated the 10 right now for us.
I
And
would say, I'm sorry, go ahead, Colin.
I was just gonna say, the rooms will be open, like regardless of cold weather. So it'll be open because that was the way that, and that's why there's so few rooms, was because they were gonna have to book and pay for the rooms for a month at a time in order to get the best and most affordable rate to help the most number of people possible. And while Open Table will have those rooms for a month, the people coming in will be given X amount of time or X number of days. And if they're working and doing the things they should be, like in an emergency shelter, then, you know, they'll continue to stay. But if they're not doing and not working on things, or bringing in unwanted guests or creating trouble, they'll be asked to exit the facility and a new person coming in. With that said, it is entirely possible that the first 10 folks in may be there the whole winter season unless they're able to move out. So that's why it's kind of important to make sure we prioritize this correctly, so we've got something. And the hope is that we can utilize some of these targeted rapid rehousing dollars and use the motivation that when cold weather shelter ends, when white flag ends, folks would be unsheltered or have to go to an emergency shelter. And a lot of people don't want to go to an emergency shelter after being in a motel. So my experience has been using that as a motivator to help people find and move to permanent housing is a good way to help sort of turn those rooms over a little bit more frequently.
So this is going to be no surprise to anyone, but I would recommend 6 for the families and 4 for singles, knowing that singles can double up, and looking at how quickly or how drastically the percentage of homeless families have increased just since December. We're seeing a higher percentage in families than we are in anything else. So that's my reason for my argument.
I agree, Tammy. And just from the school side, our numbers are extremely high right now. Normally, around this time of the year, we're nowhere near 400, but this year we're at 451 students who have identified as McKinney-Vento. Now, they are not all unsheltered. We have about 25 of those families that are unsheltered, but that's an extremely high number for just 2 weeks of school.
I understand. So we have two things. My suggestion was 60-40 singles, families, and I think Tammy's suggestion was 60-40 family, 60% or 6 units, 6 of the 10, and singles 4 of the 10. It kind of blends into the last item on our agenda about families. I wanted to talk to you guys about an idea that I have, but at this time, let's entertain the 2 options that are on the floor. If anybody has any other suggestions, or do you guys want to move? I'm, we have all these people that we need to serve, so I'm for whatever the group says, what the group votes upon. So how do you guys want to move through this? I wanted to talk to you, Ebony, anyway, because I figured your numbers were high. Any additional suggestions?
I was just going to say, I feel like it might be easier. It's never easy, so don't misunderstand me. It might be easier to find alternates for singles than it would be for families. So giving families the higher numbers of those rooms just makes more sense to me.
So you're in support of the 60-40 families with the more units. Okay.
Yes.
Historically, we have had challenges with families showing up in those rooms, but maybe it'll change this year. But I think if we set them aside and prioritize it, maybe we'll have a better luck of, if the first family doesn't show up, then we can go to the next family on the list. Either families are resolving when all of a sudden they're like, oh, I don't want to go, I don't like that motel, I want to go somewhere else. And all of a sudden they find a friend or a family or self-resolve somehow.
That was one of the reasons why I asked the name of the hotel. I know a lot of families did not have good reviews of what was it called? Hometown Studios, with the crimes and with their children. So that was one of the reasons why I asked that question.
Yeah. And that's one of the reasons that Open Table was trying to move it somewhere else and hope for a better experience. And they feel that this location is a little bit more secluded, a little bit safer, they feel, and think it'll be a better fit for the population that we're trying to help, and hopefully reduce some of that, some of the nefarious stuff that was happening around some of the other locations that have been used in the past.
Okay, so it sounds like I'm hearing, because I've also got some things in the chat for folks who are or in the place of 60-40 families and singles. So, I mean, we need to formally vote on this, Colin, or can we just say 60-40?
We should formally make a motion and vote to set it
So
as the prioritization policy.
I will entertain a motion at this time.
I would make a motion for 60-40, 60% families, 40% singles. Did I do that right?
Mhm.
Yes. I'll second that.
motion.
I second that emotion.
Who was it that seconded? I'm sorry, I'm taking notes.
I think Helen did,
And I think Angela did as well.
and
Was that you,
Angela.
And Tammy.
And Tammy. I think we got a second, third, fourth, and almost have a full vote at this point.
Okay, so we have a motion and a second. All those in favor put yes in the chat. Opposers have the same right, and if you want to abstain, you can do that as well. All right, it looks like the motion carries. 60% for families, 40% for singles. And so, Colin, if we phrase it like that, if the number of rooms increase, then the number of units for families will increase as well. Is that correct?
Correct. It would stay
right.
in 60%, 40% ratio, regardless
Gotcha.
of the number of rooms. If it goes up or down, it'll stay in that percentage.
And for singles, the most they can do is doubled up. They just only have double beds. None of those places have like bunk beds or anything in them.
No, they're just extended stay motels, so it'd be like the double occupancy.
Gotcha.
I don't know
All
if they would feel comfortable with us putting mats in there and making it 3 or 4 people in a room.
Oh, no,
That
I
might
wouldn't
get
say
a little
mats,
too
but if
tight.
it was a bunk bed in there, I was like, well, maybe we can get more than just 2 singles in there.
Mhm. No, that's, Colleen's got a question, or her hands up anyway.
Yes, Miss Colleen.
And I know I'm adding this late in the discussion, but I just wanted to share from the college perspective, because I don't think we've talked about them much. The only issue we have about 5 students right now who are in that situation of imminent homelessness, that kind of thing. And the issue that we're having, we send them to the resources, and we're finding that they need quicker emergency housing to support them. So in consideration of all of the things that we're doing, is just a way to accommodate these college students, because sometimes, within 30 days or within 20 days, they can support themselves again, but they just have those quick gaps where they do need some support. They may have gotten kicked out of their parents' home. It's just different things, may not have access to the dorm room immediately, that kind of thing. But if we could have a way to think about that and consider it, I just wanted you all to put that in your minds for consideration and thought. That's all.
And life skills, they wouldn't be able to help that that group. I think Ebony put that in there. I was thinking it in my brain. Ebony put that in the chat.
And
Life Skills
Really?
Foundation.
That's
I
super
thought
specializing.
it was from 18 to 23.
Mhm.
So most college, I'm sorry, I'm in the kitchen now, but most colleges, age is up to 23. So I'm really surprised.
No, I didn't say no to life skills. I said you suggested life skills. I was thinking the same things.
Oh,
I'm just curious, can
But-
life skills accommodate? Have Ms. Collin, have you had a conversation with life skills around that? I know that, or
they're,
they can't.
they're right around the corner. I will see, because she's been going through the traditional route that all of our other persons have been going through, which is the open door. So
Mhm.
that was it. That was the reason. All right. I will put that on their agenda as well.
and Ms.
Excuse
Collins,
me.
most times they have more support before entry point can, life skills. So always be that be your first point of contact.
So, Ms. Colleen, when you get an opportunity to talk to them, can you just kind of let us know? Because I would just be interested in knowing about us having that as a potential option for our college students, because it would just be good to know that we have it.
I
Absolutely.
have a question from
Mhm.
Ms. Colleen. What about the students that have children that are homeless? What do you do with that?
Um,
Or have a child?
they go through the traditional routes.
Same route.
Yeah, during open doors. But what I was gonna say is, right now we don't have any with children, but that is what she would
Pardon
do.
me. Say that
Mhm.
again, please.
I just said at this time there are none with children, but what she
Yes, ma'am.
is doing is sending
Yes,
them
excuse
through
me. Yes, there is.
that
You have
not
someone
that has been reported to our Dean of
with a
Students
child.
office.
Okay. Well, you have one with a child.
No, I think what Ms. Colleen is saying is that she's not aware of a student with a child. So
Okay.
that means the student hasn't followed the channels for Ms. Colleen to know that that's an issue.
Right,
Okay.
So we need to
right,
make.
right.
So
That's
I
what I'm
think,
saying.
Miss Angela, it's good to kind of know, like, Miss Colleen, are you the point of contact or somebody else is the point of contact when a student is in that situation? Because we need to know what those chains are. And, I've said before that we don't always bring up our college students who are homeless enough for us to, like, have an idea of what the needs are. Like, if I get one, I'm gonna call you directly. But that's me. I don't think everybody does that. So us kind of knowing the channels of how we navigate or direct somebody back that way would be great, just for us to know as a continuum.
Right. And I was just going to say, not only for this matter, if they're having, some mental health concerns, just whatever they're having in terms of short-term, those real traumatic issues, they go through the Dean of Students office.
Okay.
So that's for
Thank you.
everybody. The point of contact is the Dean of Students. And that's on most of the college campuses, is going to be the Dean of
Can you
Students.
give us a phone number or a name, Miss Colleen?
For NCCU, it would be Star Dorset, DORSETT. And her number is 919-530-7492. If they're having a housing challenge, or if, some kind of crisis comes up for them in terms of their ability to remain in school, she's the point of contact.
Good stuff. Great to know.
And I
Can
put
we
it in
make sure
the
that's
chat.
in our minutes? Can we make sure that information is in our minutes?
I'll put it in the chat so it can make sure you have it included in
And
addition
then
to her email as well.
somehow, Colin, can we get this information onto our site that I'm learning just recently is going to change? It's no longer going to be where it used to be. So I do want us to get that information too when you get a chance to give it to us. But can we make sure like information like this gets on that site? Because a lot of times when I'm having conversations with people, I give them DurhamCoc.gov as the resource. Once I verbally give them the information, but I tell them if you ever lose it and you need to go back to it, go to this site, because I believe that that's where all our information should live, and people should be able to get guidance from there if they're technologically savvy, or if the person providing services to them has the access to be able to do that. I think it's so important. So can we just make sure this information gets there somewhere?
Like, are you asking to post the Dean of Students information?
Well, I'm saying
Or,
it might not be the first thing people see,
Mhm.
but if you are a student and you are having these issues, or like even the LGBTQ center, like things like
Mhm.
that, especially the projects that we're funding as well, it's, if there is some way people at least know the contact or the protocol or what they need to do, so that we make sure that we're doing the best we can to touch as many of the subpopulations of homelessness in Durham. I mean, because a lot of times our chronic folks, our folks in the shelter, our street outreach folks, like those known folks are the ones that the intensity of services are kind of directed to, but we do have all these other gaps that we don't really see. So I feel like if we can at least be able to use our site as a way to get people to the right touches, so that if there are problems, if there are needs that we need to do as a system, we're starting to like broker and bridge those gaps and get information that we need so that we can do better as a continuum.
Yeah, I think we can put something up on a general piece. I'd be hesitant to list every dean of students at every
No, I
college.
went.
Yeah. But
Could say contact the NCCU, contact the dean of students office, or it can just be that simple, and then they may
Sure.
be able to find it up. But we just need to be able to let people know where their access points are.
Yeah, we can look at doing that. We're trying to work on getting everything migrated and updated on the city side website. So we can add that to our list of looking at doing.
Thank you.
And I think, Colleen, you raise a really important point, and it's something I think, Jeff, let's make a note and think through, because policy and planning may need to come back and look at how we prioritize and how we have structured our coordinated entry system, as the coordinated entry system sort of sets all the resources for those who are most likely to have a negative outcome if they're on the streets. And it tends to gear towards older, sicker, more vulnerable. And generally speaking, college age students tend to be younger, healthier, and are sort of a lower priority piece. So we may need to take some time and be intentional thinking through how and what is the best way to map a course through, how do we refer and how do we better meet the challenges of that particular subpopulation.
Sure thing.
So thanks for bringing that up, Colleen. It's really important to keep our minds wrapped around.
Ms. Colleen, I'm also just curious, do all the deans of students or like departments at the various colleges, do they meet together and talk about stuff like this?
That I'm not sure of. I'm not sure.
Okay.
I can inquire about that as well.
No, I just know in the past when we've had the opportunity to have conversations about the college age students, like it's always something new that I learned, that like, yes, Duke has homeless student issues. And so it almost makes me wonder, should there be like a subgroup of people kind of looking at that and coordinating efforts, and then maybe informing like the COC, the homeless COC, about our issues, because I think even in the past, in our attempts to try to look at our youth homeless problems, we've been unsuccessful. And I think some of that is because we're not collaboratively working together on issues of commonality like we should. And that we just need to do a better job.
Well, I know we have a representative from each of the schools, both Durham Tech, Duke, and NCCU. But I'm not sure if there's conversation at a different level.
Thank you, Ms. Colleen. So moving along, the next item on our agenda is the discussion about how to serve older clients with high barriers. Colin, you want me to give a little bit of information, or you want to give us some numbers?
I will defer to you, Madam Chair. If you'd like to give some background and then I can do numbers, that would be fine.
Okay, so before I came into the hospital with my daughter for this last go around, I had the opportunity to be back at work for almost a month and to just kind of peruse what I was seeing around UMD. And what I've been seeing, even before being, still working and navigating, just the influx of a lot of seniors coming into homelessness, um, especially a lot of first-time homeless senior citizens who, have no clue how to navigate the homeless world, but also have a lot of challenges. And I didn't know if any of you guys were seeing any of that as well. But I'm really concerned as we move to a 30-day shelter and we have disabled seniors expected to follow a regimen that just kind of their lack of knowledge and then their disabilities in whatever level kind of hindered their ability to successfully process and navigate things in a 30-day time frame. So I asked Colin to kind of give us a glimpse of hopefully our numbers from last year and then kind of where we are now, because I'm just wondering where we are and if we need to be focusing some of our energy and attention, or at least making the powers that be aware that, even though we have we have senior affordable housing resources in our communities, we're still seeing a lot of seniors displaced, and we need to be doing some strategic work or getting the senior center on board with helping kind of some of these folks, or making sure people know where the senior center is. I don't know what we need to do, but we need to get a hold of it, because it's going to make helping those folks, secure housing a bit more challenging. And it just breaks my heart to see, just like we hate to see children out there. I hate to see somebody's grandma out there who can't do a lot of stuff, or might not be computer savvy, or just hanging on, sitting in their car all day because they have to be outside of the shelter. I'm seeing lots of that. People without limbs, things like that. So I don't know if anybody else has seen it, but I wanted to bring it to our attention, and hopefully Colin can give us some information today that can shed some light on like kind of what that looks like right now.
So as Sharita said, she and I talked late last week about this. So I did pull some data. Let me share my screen here, and I can try and share some of the data I pulled. All right, can you see my screen?
We can see it.
Perfect. All right, so I tried to break this into a chart and visualize what we have. And if you look at the left-hand column, the left 1, 2, 3, 4 columns are for the year 2021 to 2022. And what I used for the time period was the longitudinal system analysis reporting dates, which is an October one. It follows the federal fiscal year, because that's our data that is most recently cleaned up and easiest to compare apples to apples. So I looked at the 2022 and 2020 to 2023, which is October 1st, 2022 to September 11th of 2023. And I looked at October 1st, 2021 to September 11th, 2022. And here's what I found. Essentially, if your top 2 rows are total numbers of seniors, which is 55 plus for this, looking at your total homeless population. You're looking at, if you look at 55 plus in 2021, 29.5% of the population experiencing homelessness are seniors. And so far this year, we're at 30%. So the percentage is basically holding steady, that roughly a third of our homeless population is 55 and over. I did go in and look at two subgroups of veterans and chronic homeless, and you'll see those numbers below. So the veterans, you're looking at basically those numbers holding flat in the 55 to 61%, and a small jump in the 62 plus. But when you look at the number of people, you're looking 11 more people, and you're looking at, same number of 55 to 61-year-olds, which I thought was interesting, that would exactly 45 people in that age group for 2 years in a row. Then if we look at our chronic homeless, we're seeing a decrease in chronically homeless between 55 and 61 from 103 to 82. While that's a good number, the total number of people served was less in 2022, 2023. So that's why the percentages are a little bit different. And our 62 plus, we're looking at 62 and a jump to 71 in 22, 23. So almost 1% increase in 62 and over chronically homeless. And the chronic homeless, if you recall, requires multiple episodes of homelessness and a chronic health condition. So, that I think is the number that Sharita is talking about, looking at how are we going to continue to solve the issues for chronically homeless senior citizens with disabling conditions, when you'll see here just some thoughts here is limited income. We've got seniors, or even not just seniors, but others who are unable to care for or clean apartments that lead to lease violations. And how do we serve seniors or others if there are no assisted living beds and they need something more intensive than being able to live on their own? So these are kind of things to think about and talk through, but wanted to make sure you saw the numbers and the trends. I'm going to started pulling the 2020-21 data to see if there's any other numbers that are jumping out at me, but I haven't had time to get that pulled yet.
Colin, can you go back to the challenges slide for just a second?
Sure.
So what I will ask is that I also have several seniors in housing that are having the number 2 challenge. Is they're at risk of losing their apartments because they can't clean them because of their disabling conditions and lack of natural supports. And I'm doing everything I can, but when a person's apartment needs to be cleaned and it gets to the point where it's unsafe for them to be there, and they don't have any money or any extra money to pay for a cleaning service, we don't have a resource in our community that goes in and helps clean their apartment. And I see this has been, I think this has led to probably some of these seniors losing their housing too. The ones that I've been, by the grace of God, putting things together, and sometimes Project Access, thanks. I'm grateful to Sally's team can help sometimes when we just have an emergent issue that needs to be done, and get people. But if it's huge, we don't really have a resource in the community. And then once that person gets turned out, it's a challenge for the shelter. It's a challenge for those who are serving those folks, and it just makes them sicker. So the numbers are not as large as I expected to see them. I'm kind of grateful for that, but I'm also afraid of what that means for the future, because we do know that our population is aging. So we're going to see this more. So I don't know if anybody has any questions, concerns, or want to discuss it. We can move on to the next item. I just wanted to be able to bring those things to your attention, and you may have some of those people falling into the shelters or to our system and it's just not a lot of resources. A lot of the seniors also, some of them don't want to give up their money to go into a facility. And then you have a group of seniors who they have Medicare, and they are not eligible for Medicaid, and their income is not high enough to pay out of pocket for a facility. So then that's a conundrum, because you don't have a way for the person to qualify for Medicaid to be able to get it because their income is too high for Medicaid. I think my hope is that as we move towards Medicaid expansion in the coming year, they say October, but next year is what I think is when it's going to actually happen. That might open up some doors, but Medicaid alone does not get you the opportunity to access a facility, because there still needs to be income associated with that process. The person still has to have income. They just can't Medicaid alone qualify for a facility. So just something to think about.
I think one other thing just to consider that, when we're looking at the data, what we know is that people that are chronically homeless have a shorter lifespan.
Right.
So it could be that, maybe they're not, maybe this sounds very morbid, but maybe they're not exiting to go to a home, but, we may not know where they're going, because we do know that that's a fact of chronic homelessness, shorter lifespan.
And Tammy, to your point, I did look sort of at exit destinations, and one of the exit destinations on our system performance report is death. As morbid as that may be, we do track that as an exit destination. And for the time period 21 to 22, 11 people passed away, and 22 to 23, 10 people have passed away. There is a caveat. I am not sure 100% of those deaths are for 55 and over. I have not had time to go in and look at each. It just gives me a HMIS number, but I have to go look at each individual client record to find the age of the person. And I just haven't had time to go through those records to find the ages. So I will, just a little small asterisk, they are not all seniors. I cannot definitively say that at this point.
All right, guys. And so thanks for that conversation. Anybody else have anything?
I just had a question in the chat about do you know if there have been conversations about trying to get some clients with Medicaid to qualify for a home attendant? They won't do like deep cleaning of a home, but typically a home attendant does assist with like some light cleaning, keeping things tidy for those with disabilities who may not be able to do those kinds of things for themselves.
So from the healthcare from the homeless perspective, we do try to help any of our clients who express to us, or where we know that there's a physical impairment and they need assistance, because not all clients are honest about kind of the state of them being able to keep their house. And a lot of times we find out after the fact that it was bad. We do try to connect them with it, but it's still a process. And if a person has Medicare and no Medicaid, sometimes depending on the Medicare they have, it may not offer that as an option for services. I'm in the process of reviewing some reform stuff that recently occurred or that's being proposed by CMS for Medicare beneficiaries, but I haven't gone through it all because I'm doing it just for my own knowledge, because Medicare for so long has inadequately served our seniors. Putting that there are some caveats in there, but it's still a challenge. Medicaid opens some doors that Medicare can't. And so that's a challenge when you have a person with just Medicare. VR does have an independent living program that can specifically work with seniors, and where the state would pay for a certain number of hours, but the state determines those hours. The unfortunate flip side of that is that the client is responsible for finding somebody who's willing to take the rate of pay. And I think the last time the rate of pay was like $11 an hour for how many ever hours the state deems that they're willing to pay to keep. The whole purpose of the program is to keep the person from having to go into a facility, but it's a tedious process. Like they have to come in and do a home assessment. It's a lot of moving parts and pieces, so it's not a quick fix. But I have been able to navigate those, and I don't know how many other people navigate those resources, but because I work with people who don't have a lot, I just kind of try to figure stuff out wherever I can figure it out at, and then I just keep it in my bag of tricks, and I pull it out when I need it. I can't speak that everybody does that. But that's also a challenge, and home health workers don't necessarily clean your apartment, but they are there to assist. Any other questions? Oh, I see Sally's. I would love to know how other communities handle support for keeping houses clean and persons who need, and for persons who don't have the money to pay for the facilities. I would be interested too, because
So
we're at a deficit.
Yeah, I think you bring up some
Go ahead.
important. I think you bring up some important topics for future conversation.
And I can talk a little bit about the persons who need family home care or assisted living facilities, but don't. And if I'm understanding your question correctly, Sally, it's they have some money, but they don't want to use their money to pay for it.
Correct.
So experientially, in the 5 or at least 4 other COCs that I've been in, all participants in homeless programs have right to self-determination as long as they're sound mind and body. And when people are recommended for those types of facilities and they choose not to pay for them, they're allowed to not pay for them. And the trade-off is they remain homeless, unfortunately. The only caveat is if someone is able to determine they are not of sound mind and body and are required to have a payee, at which point the payee is able to sort of step in and make those financial arrangements on behalf of the person.
Well, Colin, that is a whole process in itself here in Durham County, because it's very difficult for us to get APS to take a case, substantiate it, and do the things we need them to do. Sally can speak on it. We've gone through it a lot of times, and a lot of times these very people that we're talking about, this topic right here, the Healthcare for the Homeless Clinic and Sally Wilson Project Access, usually end up getting the bulk of those folks.
Absolutely.
And trying to figure out how to navigate and get them what they need.
The other thing, because people can be forced to take a payee by the courts, or people can voluntarily agree to a payee. And, you know, it's not easy, but I have seen organizations be relatively successful in helping people to agree to having a payee working with them on these types of things. It's not easy, but it can be done from time to time, but it takes a lot of work. And it's a voluntary setup versus a court mandated setup.
And I'm looking at the time. We have about 15 minutes because our meeting is scheduled to 12. Is that correct? Okay.
Yes, ma'am.
If nobody has anything else to add, I would like for us just to touch on this family's conversation again, just revisit it for a little bit, if you guys don't mind. So early on in our discussion, I was kind of talking about, we were talking about families, and we were talking about also the white flag process. And, you know, in the past, we've gotten churches to be able to help us financially do some things. But I had a thought this morning, about maybe us asking churches to maybe sponsor some long-term extended stay rooms, maybe even one family at a time, to kind of help us deal with these numbers that are just growing, and we know it's going to get worse in the winter. And I actually issued a challenge to my church, so I've already started. So I started with me. I called my pastor this morning. I said, can West Durham Baptist Church consider sponsoring a family in an extended stay for a longer period of time than short term, in hopes that to give the system, a break a little bit, help share it a little bit, but also, with the aim of trying to get our numbers down and control. And then I suggested to him us challenging other churches to follow suit with just one room for a family. And so my motivation for giving that lower breakdown of number was that I think that this actually might work. I think that it will require us to do some additional finagling on how we support the churches who agree to take it on. But I feel like there are so many churches in Durham, and if we can get a few of those churches or a handful of those churches to take on one family at a time, we might be able to do a little bit more help around helping our families have safe places to stay. And I just want to kind of bring this up as a conversation for the group. Like, how do we continue to better serve our families, not just on a temporary basis, but in a meaningful way, or at least to like bridge housing until the natural housing processes can kind of fall in line and help us transition folks. But at this point, it is beyond our system. Like, we can't keep trying to patchwork fix it. It's not enough of us to patchwork fix it. We need a community to help us do this. And so that's the challenge I've laid before my church. I'm waiting to see the outcome of that request. Most of the time when I make an appeal like this, my church usually responds, because we are definitely missionaries at heart and we want to impact our community in a positive way. Yeah, I just wanted to kind of open up that conversation and pick other people's brains to see if they maybe know of churches that they think might be willing to do this thing as well.
Sharita, I think this is great. Ms. Colleen and I started something like this last year. We wasn't able to move further like we wanted to, but one of the things I was hoping that we could have done was maybe have a meeting with the pastors in Durham, just to be able to share with them what the concerns are, because some of these families who are experiencing homelessness are a part of their congregations. So I think they should at least have an idea of what it looks like for the families that are attending their church or could possibly attend their church. And then also maybe we could just build on the churches that I know that have supported our office in the past. I wouldn't mind sharing that information with you. But Union Baptist Church is a really good church that helps with our homelessness in Durham Public Schools.
I do want to say that, families moving forward, this is part of our heritage, our legacy. That's how we started with churches doing this. We do have it coming up at a future board meeting to discuss in ways of engaging the churches to start something similar again. Some of the discussion items that we're kind of grappling with is making sure that there's not any proselytizing going on with the families. We want to make sure that it is strictly for shelter purposes. And then I'm not quite sure, I know many years ago, it was the churches did not qualify for any types of federal or governmental funding. And I don't think that I don't think that they do at this point. So I think that whatever we would be asking of the churches would be something that they would be willing to help fund. And what we probably could do is leverage foundation funding. I can't see an opportunity for leveraging our governmental funding, but I do see that we could possibly leverage some of our foundations should our grantors agree to that. So we've been looking at, as we've watched these numbers increase every month when we get together, we've been throwing out some brainstorming ideas on how we can tackle this problem, this issue. So Ebony and Sharita, I think you're absolutely on the right track. And we know it's worked in the past. That's how families moving forward, has come to be what it is today. And tough times call for tough measures. And we just want to make sure that families, wherever they stay, that their own faith is being respected, and that they're still able to practice their faith, even if they're staying in a church that has a different type of faith.
I hear what you're saying, and you know, when the ask that I made, and this might be a part of, I don't know, a few of us as a group get together, we can get some ministers together and we kind of just do like a presentation for them about kind of what our ask looks like. But I know when I made the ask to my pastor, my ask was not necessarily for a circle of support per se, more than just a financial, a church body sponsoring a family to not be on the street. Beyond that, I'm not saying that that's not something we might not be willing to do, but you know, there are other things that we need to take into consideration because we don't want to, you know, set churches up for taking in a family that has challenges that they as a church body are not able to meet as well, because it's gonna go back, you know, reflect back to the church that's paying the entity. So I think, you know, there are things that we need to do around it, but I have asked my church to do this. And my hope is that, and I think that my pastor will challenge other pastors, definitely. He has a very powerful way of doing that. So I think that he would definitely challenge, and we will potentially get some responses from some other churches who want to do it. And I mean, it's one family at a time. It's not, we're not asking them to sponsor 3 or 4 families. I think if we just ask the churches to help us with one family, and that family could change over time. That family could change, but I'm asking for long-term assistance from a church for one family. Is what I'm saying, and I think we start at one. You know, it might grow, it may not grow, but definitely we are past the point where us as service provider can meet all the needs of all these populations alone. We need community support.
Sarita, I was gonna just say that this is brilliant, but also I wouldn't necessarily limit it to one ask, especially if it's a collaborative conversation, because some congregations are large. So we could just simply talk about the top, 3 to 5 issues, right? One is needing social workers to support. The second one would be needing landlords. There are some people that are members of churches that own properties. And so if we just put a collaborative sort of say, here are the top 3 to 5 issues affecting these folks or this particular population, can you help us with any of these? We might get some more traction around it.
Ebony and Colin, if I'm not mistaken, didn't we do that last year, the year before? We asked churches if they had properties that they were willing to allow us to use?
About 2 years ago.
I thought we were mostly in a planning phase. Like it wasn't on the implementation yet. We were still trying to get people at the table.
Mm-hmm.
Right. And I think like us having a conversation with our congregations of faith leadership about this and them saying what they can do and they can't do is a start. But what I do know is that we have 56 families and 40 at risk, and we don't have the capacity in our system to bring those folks in, and we don't know what our capacity is to turn those families out into permanent housing, and that and we only have so much funding, and that's inadequate, and we don't have but so much staff. And that keeps changing, just like everybody else's employment pools are changing every day since the pandemic. We just gotta get from up under this, and we gotta get these babies off the street.
Another, just thinking this through in terms of we really want people in permanent housing, it may be worth sort of looking at, rather than a church spending, $3,000 a month renting a hotel room for a family, that $3,000 could pay rent for 2 families in 2 different places, and working with our rapid rehousing or other supportive services groups and saying, hey, if the rent is paid by a church, could you free up that rent money to do the supportive services and provide some supportive services to that family to help them over time bring that down? And then the church would be able to also serve possibly as a backstop when the family runs into a food insecurity issue. It could be hey, we're collecting, food for our sponsored family, kind of like the angel trees that we do at Christmas in churches for gifts. And it would sort of be an adoptive family and help do that versus the temporary piece, and building community and helping a family to sow some roots in the community rather than in a hotel room. Just another way of reframing the same problem.
I agree. I'm just thinking about the immediate need, because when I see that number, and if these people truly don't have a place to stay, we don't want them to continue to be unsafe in cars, or whatever. Our city, the safety in our city is not getting better; it's getting worse. So even if you think you're in a safe place, bad things are still happening in places that people think are safe. So that was my challenge this morning, but I think that we hopefully can do some work around this, and it's not just a white flag response, but the beginning of a kind of faith-based, grassroots, meeting the needs of people in our community thing that we need to be doing and should have been doing a long time ago. What is the action plan for meeting with pastors? I don't know, Ebony. I don't know, Ebony. I think we need to figure out as a group like what we want to do. I'm not opposed to being a part of those conversations. I issued the challenge to my pastor already.
Could we be invited to your meeting, Tammy, or is this just a closed meeting for the shelter? I don't want to impose on your meeting. I'm just trying to figure out where do we start?
I mean, we can always reach out to the Durham Congregations in Action and the IMA. Those are like our go-tos, right? We could reach out to them to see if we could get some space to be able to kind of have a conversation with them about, where we are, what our needs are on all these levels of everything we've talked about today, and go from there. I can go back and talk to my pastor, and I can, after he kind of meditates on this and does the ask for my congregation, kind of see if he will help us spearhead an initiative. I think he's connected to the IMA already as well. I don't know if he does any work with Durham Congregations in Action yet, but he's definitely connected to the IMA. And then maybe we can have a pastoral voice. Michael Page, his church has been very active in the community. He might be also a good person to start those conversations with. And I think he's a part of the IMA. I think he's actually in leadership at the IMA. I think we do need to set an action plan in place. And I am willing to take suggestions and figure out where we go from there. I did tell my pastor I was going to follow up with him today after the meeting just to give him a update on what our numbers look like. So. Yep, Tammy. Thanks, Tammy. And Tammy, when is your meeting happening?
We won't have this discussion until October.
Your group won't have the conversation until October?
No.
Okay.
We have a full agenda, so it's not going to happen till then. Got to keep them focused.
Okay. Well, I mean, Ebony, my plan is definitely to follow up with my pastor today, give him these numbers, and then hear back from him after he shares it with the congregation on where we are. Because usually once he makes an ask and our congregation who really believes in this stuff, they usually start earmarking funds. People start giving to a pot, and we'll at least probably start creating a pot. Is what I imagine will happen. Ms. Colleen, can you reach out to Michael Page? Because I think he's the leadership IMA.
He is not available until October 5th.
Okay.
Meaning he's not going to be available until then.
You're not gonna be able to talk to him until then? Is that what you're saying? Or he won't be available to talk to anybody until October 5th?
I'm uncertain, it's just from the university perspective, October 5th is the date that he gave us that he'd be available again. I can try to see if I can reach him though.
And
I
the
can
only reason why I
try.
ask, because I know, I figured you see him, you had the opportunity to see him, and I don't right now, because
Right,
I'm
right.
at the hospital, so,
Yeah, and I was just,
but I definitely
he's
think
not
it's
at campus right now.
okay.
Yeah.
And then Spencer is not the head of Durham Congregations in Action anymore, right, Lloyd?
You muted,
Wait.
Lloyd.
Yes,
Lloyd
that's
still-
correct. Brianna Van Belsen, who used to work at the congregation at Duke Chapel, is now the director of Durham Congregations in Action. You can use the same
I
email
don't,
address, dcia@dcia.org, I believe.
so, I don't know, I can send an email to maybe Durham Congregations in Action, maybe, do I have the IMA email? I wouldn't, I mean, I can at least send a message and at least initiate a conversation, Ebony. And I can
Angela,
CC you on that email, because it sounds like Ebony and I are really interested in this. Tammy, would you like to be invited to that conversation?
Yep, I'll be happy to go.
Okay.
Angela,
I'll send out an email to IMA and DCIA, and I will include on that email Ebony, myself, and Tammy, and we will at least start to get some conversation. I know you have to go, Tammy. Any
Yeah,
other
sorry,
questions
guys.
or concerns? Does anybody have, it is 12, it's 12:02. Any other questions or concerns? And Ebony, if you need to call me, you can.
The only thing I was going to flag is we are out of compliance with our governance charter that we do not have a secretary for this committee. And technically, the meetings that I've been running when in Sharita's absence, we're not structured to do that. We've kind of been operating in a void where the way the current governance document is structured is we have to have a secretary, and the secretary is the one who can call a meeting to order in the absence of the chair. As we don't have a secretary currently, please consider doing so. We'll probably do some outreach and talking to folks as well. But if anybody is so moved, would love to have it. We'll probably bring it up at the beginning of next month's meeting as well. So just something to think through if you've got some time and willing to serve as the secretary to call meetings together in the absence of the chair and take some very, very brief notes as we work through minutes, as we work through meetings. That would be fantastic.
All right, guys. So we need a chair. I mean, not a chair.
You're the chair.
Secretary. Unless you want me to be secretary. I can't be the secretary and the chair. And y'all hear my
Yeah.
daughter's machine alarming,
Exactly.
so I have it on pause.
All right.
everybody.
So think about it, and if no other further things, we will adjourn our meeting at this time. Folks are already leaving. Have
Sounds
a
good.
great week. Take care.
Sounds good.
Bye,
Thanks, all.
everybody.
Bye.
Thank you.
Bye.